everyone. We're going to get started now. Thank you for joining us for today's webinar. This is the Provincial Human Services and Justice Coordinating Committee webinar series, and today our topic is on immigration detention and mental health. My name is Tasha Rennie, and I am the Network Engagement and Communications Officer with the HSJCC Secretariat. Before we get started, I'm going to go over a couple of things about today's webinar. We're going to be having a question and answer period at the end of the presentation. So if you have any questions, feel free to type them into the chat box that you see in your control panel, and we'll try and get to as many of those questions as we can at the end of the presentation. Today's webinar will be recorded, so a link to the recording and the PowerPoint presentation slides will be emailed to all of our participants after the webinar. You can also find it on the HSJCC website. We're also going to be sending out a link to a brief evaluation survey, and we hope you can fill it out for us and give us some feedback on today's presentation. If you're not aware, the Human Services and Justice Coordinating Committee Network is made up of 40 local committees, 14 regional committees, and 1 provincial table. Each of the HSJCCs is a voluntary collaboration between health and social service organizations, community mental health and addictions organizations, and partners from the justice sector. Our presenter today is Michaela Bader, who is a psychiatrist and lecturer from the University of Toronto. And I'm now going to turn it over to you, Michaela.
Hi, everybody. Thank you so much for tuning in today. My name is Michaela Bader, and I really want to first start by apologizing for missing the webinar last couple of weeks ago because unfortunately I had severe laryngitis. So really happy that people were able to join today. As Tasha mentioned, I'm a psychiatrist, and most of the work that I do is with what's called an ACT team. So that's working with people with severe mental illness out in the community. I put a picture of a bike out there because that's how I go around and see most of my clients. I also do some work specific to immigration detention and to refugees in the immigration system. I see refugees through the Canadian Centre for Victims of Torture, and then I also go into detention centres. And I've been into both jails and Immigration Detention Center in Toronto to see clients, and I'll talk a little bit more about some of the experiences that I've had there, and certainly welcome any questions that you may have. I'd also want to put it out there, if anybody tuning in today is a psychiatrist who's in Toronto or actually across Ontario, or a psychologist and is interested in doing these reports, please, please, please do get in touch because there's a great need for people willing to do this work. So I wanted to start out with a story, and this is the story of Alpha and his mom, Glory. And Glory arrived in Canada, I believe it was in 2012, and was immediately taken into immigration detention. And she was 2 months pregnant at the time. And so Alpha, her child, was born while he was in immigration detention, and he actually lived over 2 years of his life from birth until he actually for 803 days in immigration detention, even though he was a Canadian citizen. Now, you might wonder, what are the impacts of this? I mean, when we think of immigration detention, what is that? So it's actually similar to a minimum security jail. His first words were radio check, because that is what he frequently heard. Because his only contact with his father was through the telephone, in the way of a child, he thought that his father was actually in the telephone because he'd never actually been able to see him in person. And a lot of his play had to do with some of the things that he would witness. So, for example, being patted down or having to stand in line. So I'd like you to keep this story in mind as you're thinking about, what is happening in immigration detention within Canada. So this is what I'll be talking about today. So I'll start off by talking a little bit about the immigration system, what is immigration detention, some statistics, and then go a bit more in depth into the mental health of people in immigration detention. Then I'll talk about some of the advocacy that's happened over the last while, and then highlight some recommendations for you to think about further. So in terms of context, I think it's important to think about trends in Canadian immigration. And what has been happening over the past many years is that there are more and more categories. If you really try to map out immigration system, you start realizing that there are so many different categories and that the numbers of temporary workers coming to Canada has increased. And so whereas in the past there used to be more secure routes to citizenship, now we have many, many thousands of people who are coming here only on temporary work permits. And so in a way, I mean, we're exploiting people for their labor. They come here, they work for a period of time, often in the agricultural industry, for example, and then don't actually have a way in which they can become citizens, even though they may be coming for 10 or 20 years repeatedly every season to work. It's also become more difficult, and this was a particular issue under the former government, for vulnerable groups to come to Canada, including refugees, parents, grandparents, spouses. And so we see an increased precarity of immigration status. There are possibilities for immigration status to be revoked. And this is actually something that I see quite a lot in my work, that there are people who have come when they are very young, either as permanent residents or as refugees. And because of the tumultuous situations that they live in, often due to poverty or mental illness, they have never been able to become full citizens. And then if they get into any sort of legal trouble, oftentimes again related to mental illness, they become deportable. And so there are some people who I have met who have been in immigration detention, actually in a maximum jail, security jail for years, due to the fact of having lost their refugee or permanent resident status. And then I think we also need to think about, particularly under the previous government, but certainly at times as well now, the demonization of migrants, talking about people as bogus refugee claimants. And I think as more and more people are coming from the United States, we have to be really careful to keep an eye on what's happening in the media and to really address the xenophobia wherever we find it. So talking more specifically about immigration detention, so what are immigration holding centers? So when people are held in immigration detention, these are like medium security prisons. There's guards, there's cameras. When I've gone into the one in Toronto, there's also one in Montreal and one in Vancouver. I have had to, put away all my belongings. You have to go through a metal detector. And when I do assessments, I find this particularly difficult. I'm not actually allowed to be in the same room as the person. I have to do it behind a sort of glass with just a little bit of space where we can speak through. There's set meal times, so it's very, very regimented. If you are behaving in a way that is considered to be disruptive, there's the possibility that you may end up in solitary, or that you would actually end up being transferred to a maximum security jail, and we see that a lot in Ontario. One thing that has always struck me as particularly challenging from a health point of view is that if somebody needs to go get medical care, I've heard multiple stories of people being handcuffed as they are being transported to medical appointments. And it's important to remember that people are not here being held for a criminal matter. Immigration holds are considered administrative holds. And so what are the reasons for detention? So one of them is flight risk. So if a CPSA officer is concerned that you might be at risk of fleeing. Now, I've actually heard, for example, a story of somebody who was having suicidal ideation, disclosed that to the CPSA officer, and due to that disclosure was deemed to be a flight risk. So it could be something related to their mental health as well. Unclear identity, so oftentimes when people flee, they're not able to bring their identity documents, so that could be another reason to be held, or danger to the public. But a while back, I saw some statistics that among refugee claimants, the number who were being held for danger to the public was extremely low. I believe it was around 6%. And so once somebody ends up in immigration detention, there are some ways that people can get out. And so at the 48-hour mark, you have a hearing at 7 days after arrest, and then after that, every month. And detainees have the right to be legally, or are able to be legally represented, but not all of them are, and certainly not all of the lawyers actually come to these hearings. And so CBSA is representing the Minister of Public Safety, and so they can be quite adversarial. And for some people who have been in immigration detention for years, every month they have this hearing, and I've had people tell me that they feel that, I mean, it's just sort of a formal thing that has to happen, and they don't feel they're actually being listened to and that their information is being taken into account. And one thing that is important to keep in mind is that there is no limit to the length of detention. So whereas if you're serving a criminal sentence, you receive a sentence, and other than in some very specific circumstances, there's actually an end point to that sentence. Whereas for immigration detention, when you go in, you don't know if you're going to be out in 1 day or if you might be there for a decade. And so, as I've mentioned, the conditions in the immigration holding centers are like medium security facilities. What I learned when I started doing this work is that a very significant proportion, and I'll show you some numbers afterwards, are actually held in maximum security facilities. And so immigration detainees will often be mixed in with other inmates who are there, oftentimes are very vulnerable. I mean, certainly people who've experienced trauma, migration trauma. I do work with a lot of people who are criminalized even outside of my immigration work, and am well aware of how prison is not good for people's mental health. We see people develop symptoms of depression, of PTSD, psychosis symptoms can be worsened, and certainly I've talked to quite a few people who have told me how being in the jail has been very difficult for their mental health. And so, for example, if I go in and visit people, so I've been at one of the jails, a couple of the jails in Ontario, I have not actually been even allowed to be in the same room as the person. I've had to talk to them through a phone, through the glass, as you saw in that photo with Alpha. And thinking on a sort of broader policy level, it's worth noting this diffusion of responsibility that happens. So in 2016, we did a petition calling on the government to stop, so the provincial government, to stop accepting detainees into jails, because you actually have the federal system, which is the immigration system, interacting with the provincial system, which is the prison system. And so you see here the quote is that when people are subject to both the federal and provincial jurisdiction, they just fall through the cracks and no one takes responsibility. And so one of the calls really, and I'll get to this in the recommendations, is that we don't think that people should ever be transferred to jails, and that the province really needs to take a stance in taking that step. So here are some statistics, and so if the top numbers are the most recent years, so 2016, 2017, and you can see that the numbers are going down of detainees, and that's a good thing. So there's over 2,000 less detainees being held compared to 2012, 2013, and also fewer who are being held for greater than 90 days. But the numbers are still high. And so in the most recent years that we have the statistics for, over 6,000 detainees were held in immigration detention. Average length of stay was close to 20 days, so 19.5. In terms of being held in provincial jails, that was about a third. And then in Ontario, we have about 50% of the detainee population. And again, for people who are held longer than 90 days, that was still over 400. And so the numbers are certainly still significant. Now, if we look at the statistics for children, we've also seen them go down, but still remain sort of shockingly high to me. And so these numbers include people who are kids who are Canadian citizens, foreign nationals, permanent residents. And so some kids are detained, and then some of them are housed sort of as quote unquote guests in detention with their detained parents. As was mentioned, was the longest detention of a child was 803 days, the story of Alpha that I shared. And the main reason that people are being held there is because they're detained as a flight risk. So shifting gears a little bit and moving into the mental health impact of detention. So we do have some research that is specific to Canada, which is very helpful because it does give us a sense of the context of what is happening. And so this was some research that was done with some researchers out of Montreal, Janet Cleveland and Cecile Rousseau. And I was actually one of the researchers who went into the detention center in Toronto and did some of the questionnaires with people. And I have to say, this was the first time that I'd really heard the stories of what people are experiencing. And it was just absolutely shocking to me to hear what the experiences were and the level of distress that people had. I mean, not only a population that often has an increased exposure to trauma because they have fled as refugees or they've had trauma experiences in their life before being detained, and then the detention certainly exacerbates those and can also cause the new development of symptoms in people who had previously been doing okay. So this was a Canadian study, and what's interesting here is that it looked at more brief detention, so the mean was 31 days. So we're not even including the impacts of these really long detentions that some people have experienced. And the main finding was that detention contributes significantly to post-traumatic stress, depression, and anxiety symptoms over and above the impact of trauma exposure and demographic variables. And so the researchers were able to account for the pre-existing experiences of trauma and say, actually, no, the immigration detention is causing trauma beyond that. And so just to give you some numbers, so the study, I only went to speak to the people who were detained, but the impact of the PTSD percentage in, post-traumatic stress, so it wasn't a full diagnostic interview, in the people who were detained was 30% versus in non-detained 18%. So obviously that's still higher than normal, but significantly higher in the detained populations. Again, depression symptoms, 78% versus 52%, and anxiety symptoms, 63% versus 47%. And so in each of those categories, you see that the impact of immigration detention is quite important to keep in mind when people have the experience of detention. Now, you might ask, what is the impact specifically on children? And so Dr. Rachel Cronick, and again with Cecile Rousseau and Janet Cleveland, went into the immigration holding centers and looked at the specific experience of children and was interested in what is the lived experience of children and parents and what are the emotional and behavioral responses that our children are having. And then sort of, if you're interested, you can read the paper. It's in the American Journal of Orthopsychiatry, and there's more descriptions about what are the practices in the Immigration Holding Center itself, and Dr. Cronick has also published further on this issue. So some of the things you can imagine were what they found. So kids were withdrawing, refusing food, development of anxiety, phobia, separation anxiety, difficulty sleeping, including nightmares, and I mean that's certainly what I have, when I've spoken to adults, I've seen those same things. With kids, selective mutism, depressed mood, anhedonia, that just means sort of a lack of interest in the day-to-day. And then particular to children, there's some, sand play that was done and was found that there was traumatic play or reenactments of trauma that the kids were having. And so again, some of these kids are kids who have fled violence, who have pre-existing trauma, and are then ending up in detention and experiencing the further trauma there. In terms of family separation, kids are experiencing family separations at multiple points. And so pre-migratory, of course, some people are forcibly separated from their parents due to the things that they're having to flee due to war. And then in detention, at least the detention center in Toronto, it has an area that men can be in and an area that women can be in. And then women are allowed to have kids with them, but there's no place that actual families can be together. And so kids are further traumatized and further separated from their families, from their fathers, if they're being held in detention. And so I wanted to share with you a couple of specific stories just to give you a bit more of a sense of what the actual lived experience is of some of the people who are in immigration detention. And so these are all things that are available in the public. If you Google, you can read more about the three situations I'm going to tell you about. So the first is a really tragic story, the story of Lucia Vega Jimenez. So this was, I believe, in 2013. So she was a woman who had fled domestic violence from Mexico and was working as a hotel worker in Vancouver. And again, I'm not personally familiar with the story beyond what I read, but my understanding is that she had actually sought refugee status, being rejected, and then come back to Canada seeking safety. And so she was working and she took transit, and she was actually arrested by transit police because she hadn't paid for a ticket. So that's, sort of under $3 that she hadn't paid. And so the transit police, they could have just, given her a ticket or dealt with her the way they would deal if, for example, I was picked up for not paying a transit ticket. But instead, they made the choice to call CBSA, so Canadian Border Services Agency. And in particular, one of the things that I was reading said that the reason that they called was because I guess they ran her name in some databases, and then because she had an accent, and so they were, this is definitely a form of profiling. And I read actually that in that same year, 328 people were reported by transit police to CBSA. And so when we're thinking across the country, how can we create safe spaces where people are not being sent to immigration detention, one of the points of advocacy is actually to say transit police, or in fact the regular police, should not be reporting to CBSA. And so in Toronto, years ago now, there was the passing of the Don't Ask, Don't Tell policy. The idea was that you're actually enhancing community safety when people can come to police if needed and can be safe interacting with authorities. But unfortunately, these policies are always very imperfectly implemented and really need to have teeth in order to lead to increased safety for people. So she was reported to CBSA, and she was taken to immigration detention. She may have also spent some time in a jail very briefly. It all happened over a few weeks period of time. And somebody had noticed that she was extremely distressed and actually suggested that she get a mental health assessment. But unfortunately, that didn't happen. And then she was found hanging in her cell. And she had committed suicide. She had ended her life due to the level of her distress. And one of the things that actually came out, so there was an inquest, was that CBSA had actually falsified the records. It wasn't exactly CBSA, because the other point is that they had subcontracted to a private security company who was actually running the detention center. And they had actually falsified the records for when they were checking her room, She had actually apparently tried to get a lawyer. It took her 3 weeks to get a lawyer, and it was only sort of through the help of other people in the detention center that she was able to get a lawyer. But that was only then 5 days before she could have filed her PRA, which is the pre-removal risk assessment. And so she somehow that didn't end up even getting filed. And so she was obviously so terrified and so distressed that she felt the only option was for her to end her life. And so she ended up dying when she was in hospital. And this is obviously a really great tragedy. And there have been other deaths, and I'll talk a bit more about that in a few moments. So I also wanted to tell you about the experience of Mr. Abdurrahman Ibrahim Hassan, who was 39 years old when he died. And I believe this occurred in 2015. And so he was a gentleman who had been held for about 3 years in Lindsay, which is the maximum security jail that I was mentioning to you in Ontario. Being held there on an immigration hold. And it sounds like he had pre-existing mental health conditions. Again, I was not his doctor, so I don't know the details. But from what I've read, it sounds like he had diagnosis of schizophrenia and bipolar disorder, so he may have had schizoaffective disorder. Either way, it sounds like he was very unwell. And he was actually transferred to a hospital in Peterborough. And while he was there, he was apparently eating feces and smearing feces around, just indications that he was extremely psychiatrically unwell, experiencing psychosis. And he ended up dying in the emergency department. So the police sort of oversight body, the SIU, actually cleared police who were present at the time, and then it went to inquest. And I don't know actually the results of that or if it's happened yet. But again, really, I mean, people should, first of all, not be in jail if they are that sick to start out with. And that's something that I've heard too many stories about, where people have very significant mental health conditions, and there just doesn't seem to be a way, even if people have a very good lawyer, to get people out of detention into a hospital where they might be able to get more comprehensive treatment. And then we also know that there are people there who go for years without coming to the attention of a lawyer, and so don't even have anybody to advocate for them. And so, again, it's very distressing to me that there have been so many immigration-related deaths across Canada. And so another story that really struck me was that of a gentleman who was detained for 11 years in immigration detention. Now, again, this is not for a criminal hold. It was purely because they did not know what his identity was. And so because, I don't know the details, but I can guess that it may have been because he was paranoid, he didn't feel comfortable disclosing things. Again, I'm not sure because I wasn't personally involved. But at some point, somebody found out or thought that this man, who goes by the name of Victor Winnetou, looked very similar to a man who had gone missing shortly after the Soweto uprising. So this is a very famous photograph from 1976. During apartheid South Africa, and you see a young, looks like an adolescent, carrying a even younger child who has been injured. And this man's name was Basuya Makabue, I believe, and he was he went missing, and his family didn't know where he was, and so there was some question whether the man who was being detained for 11 years was this man. Again, I don't know for sure what happened in the end, but again, really notable to me that somebody would be held for 11 years. He did have a prior history of assault, I believe, in 1994, so quite historical. But after that time, had been living his life, and and this indefinite nature of detention. When I've talked to people who have been there for lengthy periods of time, they often talk specifically about how distressing it is to not know whether you will ever get out or when you might ever get out. And so over the last years, and since 2000, at least 16 people that we know of have died in immigration detention. It may be very possible that there have been more, but those are the numbers that we know of. And so some of these have been through suicide, some of them have been from medical issues, some of them have been from other issues that we don't know about. And I mean, that is really quite staggering, again, considering the fact that, you know, a lot of people are there not because there's any safety risk that's being posed, but purely because they're considered a flight risk or because their identities are not known. So I wanted to shift a bit and talk about the community or the advocacy that has happened in this regard about immigration detention, particularly within Canada. And I should also let you know that there is a conference that's happening in Montreal in later June. And I would urge anybody who's interested in this matter to consider attending. If you need any further information, you can definitely get in touch with me, and I'd be happy to pass that on. And it's actually an international conference that's being organized by some of the researchers I mentioned previously in Montreal, bringing together researchers, people with lived experience, community activists, clinicians, to talk about immigration detention. And so I think that should be a really interesting grouping of people talking both about the impacts of immigration detention, the policy issues, and also the mental health issues. And so for years and years, there has been significant community advocacy happening. I'm most familiar with what's happened in Toronto and Ontario, but certainly all across the country, there has been migrant and community-led organizing that has been very significant. So one of the groups that has been particularly vocal is the End Immigration Detention Network. And so they have had four demands that they put forward. So the first is the freedom for the wrongly jailed, release all migrant detainees who have been held for longer than 90 days. The second is to end arbitrary and indefinite detention. And so they're saying if removal cannot happen within 90 days, immigration detainees must be released. This is something that's called the presumptive period. And if you look across different countries, there are some places that have even shorter periods within which people need to be released. They're also saying no maximum security holds, and so that's what I was speaking to earlier as well, that immigration detainees should not be held in maximum security provincial jails, and people really need to have access to basic services. And then the last is an overhaul of the adjudication process, because it's really felt that migrants don't have a fair process at this time in order to get out. There are also many people who are calling for a complete ending of immigration detention, as you can see the name of the organization. And I have to say, the more that I do this work, the more that I see the mental health impacts of immigration detention, I too lend my voice to the call to end immigration detention. And I think what's been really important about the work that the End Immigration Detention Network has been doing, as well as groups such as No One Is Illegal and others, is really having migrants themselves and detainees themselves at the front of this movement, and so ensuring that their voices are heard because they're the ones who are experiencing this most directly. Building on that, more recently, since 2015, there's been some collaboration that's been happening between health providers and legal professionals to advocate for ending immigration detention and really changing the conditions that people are detained under if they are detained. And so we did 2 open letters. The first was we had 140 healthcare providers sign on, and this was really to urge the province, at that time the minister was Minister Nakvi, to urge the province to stop accepting federal detainees into the maximum security jails. So we're saying really nobody should be in a maximum security jail who is on an immigration hold. This was also joined by a letter that was done specifically by over 100 lawyers who were joining our call to end the jailing of immigration detainees. The Ontario Human Rights Commission has also spoken out. So this was a letter from the Chief Commissioner of the Ontario Human Rights Commission, Renu Madani, who expressed her concern about detention of non-citizens in Ontario jails under the Immigration Act, and was joining that discussion through her letter. And then we did a second letter as well. This was October 2016. That was signed by 46 medical, legal, and human rights organizations, as well as 342 health and legal professionals. And this one was specifically geared towards ending the immigration detention of children, and saying, this is absolutely inappropriate, that children should not be held in immigration detention. And I think it's also really important to say that families should not be held in immigration detention, because one solution that people put forward is, well, you can just have the kids not go into detention. And it's like, well, we know that children need to stay with their parents in order for their proper development, for safety, for their mental health. And so the point is really that families should not be detained, and there should be other alternatives available if there really is some sort of oversight needed for a short period of time. Now, you might ask, what is the government response? So this is a news article from 2016 where Goodale was telling senators that he wanted to end the jailing of child migrants. As far as I know, it has not been abolished yet, and so I think continued pressure on the government is certainly needed, really to put an end more broadly to immigration detention. And interestingly, what did happen instead, this was again 2016, that there was a funding announcement, and I mean, generally we think funding announcements are a good thing. $138 million was dedicated to the issue of immigration detention. Now, unfortunately, if you actually look at the numbers, you can see here that 88.4%, so this is like many, many millions of dollars, are supposed to go towards infrastructure. So actually building better, bigger, more, I'm not sure, but more infrastructure for sure. And then only 10.5 million was going towards health services. And really shocking to me was that only 5 million was spent on developing alternatives to detention. That's only 3.6% of this huge amount of funding to actually saying, how can we get people out of immigration detention? Another important aspect of this work has actually been being in solidarity with migrants who have done hunger strikes. So there have been multiple hunger strikes that have happened over the past years. I'm not actually sure if this is the most recent, but the one that I recall that we did an open letter was in 2016, where 68 doctors, nurses, and other healthcare professionals released an open letter supporting the demands of immigration detainees who were on hunger strike. And so this is, again, just showing how distressed people really are and how much they're suffering, that they're saying, this is untenable and we need to act, and are taking that decision through hunger strike. And then another form of advocacy has been through going out onto the streets. And so there have been emergency vigils, there have been demonstrations, both at the Immigration Detention Center, noise demonstrations at the, and also demonstrations in the city. Right now, there's a case where a lot of people are mobilizing to support a woman, excuse me, who is in Montreal, who is currently detained. And again, if people have an interest in becoming involved with that advocacy, I'm certainly happy to connect you. I believe there may even be a vigil happening tonight in Toronto if anybody is here and is interested in going out to support. And so in terms of recommendations, I mean, I'm always of two minds putting recommendations forward, because I think to me, I mean, as a physician, I'm always interested in addressing things at the root cause, as we do the same way as the root cause if there's an infection. Similarly here, to me, the root cause is that people are being detained and people shouldn't be in detention. And so I'm always of two minds offering ways in which to make detention less distressing and slightly better, because I think we need to be looking at root causes. That being said, I think, you know, we can all put forward that detention should really only be used as a last resort. And I mean, I have seen people where it just absolutely baffles me why they were detained. I mean, I saw this one woman who was the sweetest grandmother who had been in a maximum security women's jail for, I can't recall exactly, about 6 weeks, I think, because she was felt to be a flight risk. And I mean, this was somebody who was absolutely baffled by this experience and really quite traumatized. And similarly, the people I've spoken to who have severe mental health conditions. And I mean, really, I don't think I've ever talked to anybody who has said, you know, that immigration detention was in any way helpful or supportive of their well-being. As I've mentioned, ending this transfer of people to provincial jails. I think, I mean, there are particular populations with vulnerabilities, and while I would say, I mean, every person I have spoken to certainly seems very vulnerable and shouldn't be in immigration detention, particularly impacts are felt by people with mental health conditions or psychosocial disabilities who are suicidal. And again, I've heard multiple stories, as I mentioned previously, of people who are being held in jail because they are suicidal. And so even if you're at the immigration holding center and you become suicidal, or if you have a significant medical issue like cancer or something, that may actually be a precipitant to cause you to be transferred to a provincial jail where it's felt that there are more services. I work with a lot of people who are in jails, and I can tell you that the struggle for obtaining appropriate services is very significant in jails for anybody, never mind people who have previous mental health issues. I mean, I think we need to have much better access while people are detained to programs and supports. And so I've talked to people who said, you know, I've been asking to see a psychiatrist for months, and it was only when the Red Cross got involved that I was actually able to see a mental health professional. And that to me is, again, quite shocking in terms of access. And then there should be legislative limits to the length of immigration detention, whether it's 90 days or even less, so that people aren't being held indefinitely. So there are lots of resources if you're interested in learning more. The University of Toronto Faculty of Law International Human Rights Program has put out 3 reports that are really excellent, one on adults, one on children more broadly, and then one on Canadian children in immigration detention. And they have lots and lots of data about the mental health impacts and a lot of narratives as well, if you're interested in reading further. We also did these 2 open letters, and we have websites that we created for both of them that, again, have a lot of the media resources, a lot of background information. And then you can certainly look at the End Immigration Detention Network website, or the website for No One is Illegal for some more advocacy-related and background information. So those are all the slides that I have. I have a few more slides that I had just in case. Why don't we start with questions? But if there are, you know, if we end up having more time at the end, I had a few slides that I created specifically for psychologists and psychiatrists or other health professionals who are writing reports. So if there are any people who are health professionals who would like to see those, we actually developed a website that I'd be happy to share. You can get in touch with me on that email, mbeder@gmail.com. And so this website has a lot of resources for people who are doing refugee reports. And so if we have extra time, I can go over some of those suggestions. Thank you.
Great. Thank you so much, Michaela. That was a really wonderful presentation. So we have a bit of time for questions. If you have any questions, feel free to type them into the chat box, and we'll try and answer as many as we can. So far, there are a couple questions here. There are a few that are referring to the statistics that you showed at the beginning of your presentation. So one of them was asking, other than minors, was there any statistics on different age groups and gender?
So I'm not sure. I would point you towards the International Human Rights Program website and to the reports No Life for a Child and Invisible Citizens, because they went through all of the statistics that were available in terms of children and what their demographic breakdown is. And so if those statistics are available, that's where you could find them. I mean, we know that there is a range of children. I mean, there are some who are sort of, adolescents and teens, but there's certainly a significant number who are also young children who are being held with their parents. And I think the other thing to note about that is that the opportunities for education for school-age children is extremely limited. I believe in one location there was a retired teacher who would occasionally come in and help. But there is no sort of regular school that kids can attend and really have a continuation of their education.
Okay, great, thank you. So another person is asking, from a psychiatric viewpoint, they're wondering how they can talk to someone who is completely shut down and won't talk to anyone. So for example, they say, if I get access, what should I say to increase chances that the person decides to open up or listen or even respond? So they're asking for some tips, essentially.
One of the questions I would have is, why is the person so shut down? It could be because of difficult experiences. I don't know if the person who's asking a question is a clinician or a lawyer or some other type of person in terms of their profession. But if you have the opportunity to go in repeatedly and to build trust over time, I think, if people have pre-existing experience of trauma and oftentimes fear of people in official situations, that can be helpful. Now, the other thing to keep in mind is perhaps there is an untreated mental health condition that is impacting the person's ability to speak. And so finding a way for the person to actually have a proper assessment could potentially be important. So if somebody is severely depressed, they might not be well enough to speak. Sometimes people even become catatonic or mute, and that's really a very severe medical issue that needs to be, or psychiatric issue that needs to be treated. Sometimes when people have psychosis, they might be too paranoid to be able to engage in a discussion, or they might be hearing auditory hallucinations or feel unsafe otherwise to speak. And again, so I would say, building trust, creating as safe an environment as possible to speak in. So speaking away from guards, speaking in an area where people can feel a bit more able to open up. And if they're still not able to speak, then really ensuring that they're able to get an assessment. And I know that even can be really difficult. So sometimes people might refuse to see a psychiatrist. There should be access to mental health care and assessment in all of the locations, but again, that may or may not be true. Just because it should be there doesn't mean it's accessible and actually is there. And so oftentimes advocacy from the outside can be really important. For people going through an immigration process, there is also something called a designated representative. So for people who may have a cognitive disability or who have some severe mental health condition that makes it so that they are unable to actually navigate the process. So that could be somebody who has schizophrenia, or somebody who has very severe PTSD, somebody who has dementia. the lawyer can advocate for a designated representative to be appointed. And actually, when I go and do assessments, I see people, I do a comprehensive psychiatric assessment, and then I will specifically sometimes advocate for, I shouldn't say advocate, but say, in my opinion, my clinical opinion, this person will probably have difficulties in understanding the process, et cetera, and would benefit from the consideration of having a designated representative. And so the lawyer can then use that to do their legal advocacy to actually get some more support for the person as they go through that process.
Great, thank you. So we have a number of questions here. Another person is asking, what do you recommend for people who have been ordered to be deported but can't return to their country of origin?
So, I mean, I'm not a lawyer, so some of these questions, I'm sure a lawyer would be able to answer more specifically. I mean, I think one of the challenges that I have seen is that people end up detained indefinitely in exactly that situation. So there is a deportation order, but it might be that the order is to a country where we're not actually able to deport people to at that point. So I think that's where advocating as much as possible for the person to get out of immigration detention is really important. I know that there have been some situations where lawyers have filed an habeas corpus application to try to get people out. Again, I don't understand the full legal details of that, but certainly there are some legal remedies that can be pursued. Oftentimes, if the person has a severe mental illness, having some sort of plan that's put together out in the community can be really helpful. And so, for example, if you're able to connect the person to an ACT team or to addiction services, or in Toronto, there's the Toronto Bail Program, which can help people to get out as well, or somehow assembling a team and going back to immigration, to CBSA, and saying, look, we have a plan in place that we can help support this person, then that can be used to advocate for somebody to be released. Because, I think one of the most egregious things is that people are just held for years and years and years because they're not deportable. And I've even talked to people where they sometimes said, if you could deport me, deport me somewhere, but that's actually not even possible. And so that leaves people in this absolute bind where they have no way of getting out. Similarly, I've talked to some other people who say, it is so dangerous for me to go back to the country that they want to deport me to, or this is a country that I have no resources in, I've not been in since I was a small child, that I would actually feel safer staying in jail indefinitely. And that to me is just heartbreaking, that somebody would actually choose to, not that it's an actual choice at that point, but would actually say that they feel safer in a jail than going back to a country that Canada wants to deport them to.
Great, thank you. Our next question, they're wondering, for clients that are not eligible for health care once released from detention, how can they either enlist your services, or can you suggest where they can send them if they're undocumented?
So this is another major problem. I'm much more familiar with the resources within Ontario, but if that person wants to, if you want to send me an email, I'd be happy to brainstorm about some resources, and we've actually started collecting. There are some resources in Toronto that people can be connected with. So maybe I'll just talk about what I know here, and then happy to brainstorm further. But this is a huge issue. In Toronto, if somebody can be connected to a community health center, they can receive health care. And so, and then they can also have the facility, if they're at some of the community health centers, they can also have the facilities fees waived if they need to go into a hospital. And so there are community health centers. There's an organization called Health for All that has a website, and that I used to be part of as well. And we were collecting all the resources in terms of different resources for people who are undocumented. There are various other clinics. There's the Scarborough Clinic for the uninsured that people can go to. There's the FCG Refugee Center. So there are various places within Toronto that people who are undocumented can seek care. Um, it is much easier to find a family doctor than to find a psychiatrist, and certainly across the country that varies. One of the really challenging issues is, let's say that somebody actually finds a physician who is willing to, in a hospital, who's willing to waive their fees. They will often still be charged facility fees just for visiting the hospital, even if it's just for an outpatient appointment. And so I'm actually part of a campaign as well that you can check out online. We have a website called OHIP for All. And we have been advocating for that anybody residing in Ontario should actually be eligible for OHIP, which is the Ontario health insurance plan that covers people. And so there's definitely a lot of advocacy needed in terms of access to care for people who are undocumented and uninsured.
Mm-hmm. Okay, so in a similar vein, someone is asking, in what ways can discharge planning staff support clients who will be leaving the federal correction system into the provincial system for immigration detention?
I mean, that I don't know that well how those transitions happen. I mean, I think if somebody has health needs, I would always advocate for them to get out of both of those systems, so not to be in the provincial or the federal detention or prison system. I think that, having health providers talk to each other as much as possible, involving any advocates that the person may have, involving the lawyers who they have, and then if there actually is an identified mental health condition, seeing are there actually community-based resources that the person could be connected to. And I mean, I know it's not unusual for somebody, for example, to serve a criminal sentence that has an endpoint. Once they've reached that endpoint, because it's come out that they have immigration-related issues, rather than being released in the community as they would because they've served their time, they actually get sort of a double punishment where they then get transferred immediately to immigration detention and their indefinite detention starts. And I think, finding ways in which people can actually, get out once their criminal sentence is completed would be one point of advocacy that I would see. What are the community resources that are available that you could actually make a treatment plan that could get somebody out.
Okay, great. And so I think in our last minute, this is again quite a similar question. Are you aware of any work being done to support people put on immigration holds post-sentencing? So, for example, they were held on remand for a criminal matter or now on immigration hold after resolving their criminal matter and receiving a custodial sentence.
I mean, I think all of the advocacy that I've been involved in has touched on some of that along with the community-based advocacy, but certainly if there are people on this webinar who have more specific knowledge about the criminal system, maybe you even work in it or have opportunities to intersect more, I would love to talk to you more, and please do get in touch with me to find out how, where those points of advocacy might be, because I think it's really challenging, first of all, to ensure that everybody's connected with a lawyer and, is getting support, but then even looking much more broadly systemically, how do we get people out so that they're not there for years?
Okay, great. So I think that is all the time we have. Thank you again, Michaela, for joining us today. That was a really wonderful presentation. And as you've left your email up there, I think if anyone has further questions, hopefully they can direct them to you. We'll be following up with the PowerPoint slides as well as the link to the recording of the webinar. So please stay tuned for that. And thanks again and have a great day, everyone.
Thank you.